Okay, so we were just talking about your story with hearing loss. So can you introduce yourself and tell us a little bit about your hearing loss and how it occurred?
Well, my name is Monique Hammond, and by profession, actually, I'm a hospital pharmacist, or I should say, maybe more precisely, I used to be a hospital pharmacist. But I'm also the author of the book, What Did You Say? An Unexpected Journey into the World of Hearing Loss, and that's basically my story. And it is precisely that unexpected journey that sort of redirected my life totally, and then also is largely responsible for me sitting here talking today about hearing loss. For me, it was a very fast kind of a thing, and I can tell you even the time and the date when I came by this. I had excellent hearing until September 12th, 2005. And between the hours of 3 and 7 p.m. that day, I went totally deaf on my left ear. I was teaching a class, and I felt that hearing go into free fall. And by the time I came home, I was deaf in that left ear. And then that was only the beginning. Then there came a very violent vertigo, or, the world started spinning attack. And I ended up for 2 days in the hospital. And so that was when life totally changed for me irretrievably. So that's how it went. It went really quickly, like bam. I had no time for adjusting here. Yeah.
And did you know what caused the hearing loss?
Well, there are good theories. This is called the sudden sensory neural hearing loss because it affects the little snail in our ear that is the hearing organ of the ear, and it affects the little hearing cells in that organ, but also oftentimes the nerve, and I do believe that I also sustained nerve damage. And the story goes usually that the culprit is a virus. And so I had probably a viral infection that was underlying in that ear. I had never any pain or any temperature or anything like that would send me running to the doctor. But I did have some thumping in that ear about a week before, just sort of like a little banging. It was probably a little muscle in the middle ear that was getting nervous, maybe because of pressure changes. So that went more than likely on. But the day before I actually came down with this event, I had a very loud noise exposure, at least I perceived it as being, at of all places at a church fundraiser. And the maniacs with the stereos were in very fine form that day. The children were trying to run outside of the room. And I even said to somebody, if you're in this all day long, you're going to be deaf. And I was there for almost, maybe 20 minutes. And I put even earplugs in because I have always had kind of touchy hearing. And so I put earplugs in, but it was already too late. And so the doctor told me that Mother Nature was basically outstripped that day of all of her powers of whatever defense she had, because that loud noise insult put me over the top. And so that was at least, how the theory went. But usually for a sudden sensory neural hearing loss like that, which is a medical emergency, truthfully, but there is oftentimes not a real diagnosis where you can say that and that was it, because you can't go and analyze the ear and the nerve. That happens on autopsy. And so actually one can donate one's inner ear upon death to be autopsied so that they can learn what has actually happened. And so the doctors can see if there are viral tracks in the bone and all of that kind of stuff. And they can donate it to the university or donate it for examination.
Well, that's interesting about learning about your hearing loss and how other people have reacted.
Okay.
Family members, coworkers.
Okay.
Okay. Can you tell me how you felt when your hearing loss occurred? What were some of the emotions you experienced?
Yeah, hearing loss is certainly steeped in emotions. And I never knew that either, because up until the day where this all happened to me, I had taken my very good hearing totally for granted like everybody else does. And so for quite some time, I really did not have a positive emotion in my body, because there was certainly nothing to rejoice over here. And so first of all, I started out with being really stunned and totally overwhelmed, because there was a very fast change in my life that was happening. And then I became frustrated and anxious because I saw my job erode from under me. And that eventually also happened. I also didn't really get the answers that would have satisfied my curiosity, at least, from the people in the medical field and from the audiologists. So I really didn't know where my life was going. And so that was extremely upsetting, and I became actually quite angry at the medical system. I felt like research, stuff that I had believed in all of my life so much, that really abandoned me. And there was anger. Maybe there is also a little bit of self-pity that slides in there, But all of a sudden, nothing was fun anymore in life because everything was too loud. I couldn't hear, I couldn't understand. It was just like being in a torture chamber. And so the progression into this feeling of isolation and depression kind of happened almost naturally. But I caught myself, and that became the turnaround, because all of a sudden I decided that I had actually become a little bit hard to live with. I could hardly live with myself. And so I talked to my husband about that, and he kind of confirmed my suspicions. And I also had seen some strain in my family and friends, And so that was when we decided we would go out for help. And this happened in the form of support groups. And so I met up with the Hearing Loss Association of America, the Twin Cities chapter here, and HLAATC, where I'm now president for the second time, and around. And I have great loyalty to that group. And then also the Marlis Soderberg Tinnitus and Meniere's support group in Minneapolis. And when that happened, when I got in with people who could understand and I could talk to, and we had speakers who came and gave us great talks, and I learned about this, all of a sudden the whole paradigm totally changed for me, because I've always been kind of a researcher and a learner. And so this became, for me, I became really fascinated with the topic, and it became like a huge research project. I also started to focus on other people, because it was not always about me, And it was basically getting that help from these groups that brought me relatively quickly from being dejected and kind of morose all of a sudden to feeling engaged and actually empowered. And I kind of have stayed that way. The whole situation refocused my life, and I was able to work through it. And so I am forever obligated and forever thankful for these support groups. And I think that they are totally underrated for their importance in the world of hearing loss, because I all of a sudden did not feel alone anymore. And that's what many people have, because they don't have a sounding board. They overuse their family and friends as sounding boards. And so then all of a sudden the social ties relax even faster and more than they might be relaxing otherwise. And how did everybody else react to this? Well, first of all, my coworkers at that time, and then also my family and friends. They were just as stunned and overwhelmed as I was. They didn't know what was going on, but they were phenomenally supportive and empathetic. And they also wanted to learn, because it all of a sudden dawned on them that actually the sudden hearing loss, if the conditions are right, can kind of happen to anyone. So they tried to also learn with me. But I also saw some frustration in them in that they couldn't help me. And they saw me turn gradually into this emotionally very confused person, sort of a bit of a mess, I always say. And so, but they didn't have any answers, and they didn't know what to do. And so it became kind of a little bit my job to release them from that responsibility and to say, hey, nobody knows. The best in the business really can't give me any answers. So I said to my girlfriend, I said, Kathy, here is what we're going to do. Be there for me. Let's have some coffee, come to the house, or let's go someplace where it's not so noisy, and let's talk about something totally different from ears and hearing loss. Give me an out. That is your job. And so that's basically where I have left it with my family and friends, because I have my connections where I have people to whom I can talk. And so I'm kind of a little bit in the world of hearing loss and a little bit outside of the world of hearing loss. And so you kind of negotiate the field.
Okay.
Yeah.
Can you tell me, how did your hearing loss affect your identity? You just touched on that a little bit about sort of balancing between the two. The hearing identity is obviously the norm in the world. So how did it feel to suddenly be in that minority position?
Well, as far as this was, certainly it was a very traumatic and a life-changing event for me that really, in particular, totally redirected and changed the rules of engagement when it comes to communication. And so from that point of view, things have changed. And so also when I'm communicating with family and friends, there are certain things that we are doing differently now. And that's basically an adaptation. As far as it has also opened my eyes to all sorts of different things. And I never knew really a lot about the world of hearing loss. So this was a totally new world for me. And I really believe in the cause of the people with hearing loss, and I'm actually have become a great advocate for them and for all of us, actually. As far as affecting my identity, when one talks about identity, one talks about core values and all of that, and they have not changed for me. They might have, had I not caught myself at some point in time. I might have just turned into that chronically angry, morose person who feels totally misunderstood. And so that might have happened. But because I caught myself, I think I remained the same person deep down. I have actually become more compassionate and more patient. And I have learned a lot about a totally different world and about totally different new things in medicine and in research and everywhere. But I'm still the same person. I still love the same people. I still love doing the same things. I'm still excited about the same things. I love history. I love research. I love learning. And so from that point of view, I really don't think that I have changed. But one does get to be a bit of a hybrid as a person who has hearing loss, because you do negotiate between the two worlds, and so, but the core values really have not changed.
Okay. Do you use any kind of assistive listening devices or technologies?
Yes, ever since I did regain, from going totally deaf, I did regain some hearing on that ear. And I credit there the fast intervention, the fast medical intervention. And actually, had it not been for that vertigo attack, that totally, I don't have to really specify what comes with vertigo, where people all of a sudden become, really sick. And had it not been for that, I might not have sought medical help, because people oftentimes do not go with these hearing decreases to the doctor because they figure that they have a cold and it might come back. And so at that point in time, of course, I did have intervention. And that sort of changed the whole thing, and so that's what I credit basically for getting some hearing back. And I have used a hearing aid ever since that time. I have certainly had multiple trips to the audiologist, and I have tried lots of different brands and types and all of that. But I haven't had from hearing aids that factor that many people have had, where they have been helped beyond their wildest dreams by some of that new technology. And I believe that it is a lot due to, I feel that I have nerve damage. And whenever you have nerve damage, those signals that are traveling to the brain and stuff, they are substandard, that they are not right, and not even the biggest technology can really help with that. And so I do use assistive listening devices or an ALD, maybe a little FM system, or, to watch television, because depending on what the circumstances are, I actually feel that they are sometimes more effective for me than actually technically a hearing aid. And so it shows that all hearing loss is different. Everybody has different needs. Everybody is helped by different technology, sometimes by a choice of technology, all sorts of different things. And so there is, however, within the general community and public, there is this misunderstanding about hearing aids. And one of the comments that really affected me probably the most of anything that anybody ever said to me was a woman who said to me kind of dismissively, well, if you have a hearing loss, you just go and get yourself one of those hearing aids, girls, because that is really so helpful. And, they'll fix you right up. A hearing aid is not a fix. A hearing aid is an aid. It helps us make the most out of what we have left, but it does not fix anything, And when it comes to the biggest challenge of that people with hearing loss actually have, and that is understanding speech in a noisy background. Yes, we all know that one. Then all of a sudden hearing aids, they do not really undo that spaghetti bowl of sound that we are continuously exposed to, really sort it out like Mother Nature once used to do, And so they do help, but they have their limits. And that's something that we have to understand when we're dealing with people with hearing loss. If one says, well, yeah, oh, she doesn't hear very well, but she has hearing aids, so we're okay, we don't have to do anything about this. No, people with hearing aids also need accommodation. You know, they need to have the communication setting just right, and they need to have adjustments. Hearing aids help us, but they are not a fix, you know.
What are some things that you do to advocate for your own communication needs in a, whether it's at, you know, choosing the restaurant that you go to, or, you know, letting people know about what your hearing loss is? What are some of the things that you're doing to let people know what your needs are so that you can have the life you want?
Well, for my family and friends, they of course know it because, you know, we do this all the time. For people, if I don't know people so terribly well, you know, I'm a preparer. I don't like to be surprised by things, and that is basically something new that was introduced into my life, because before I didn't have to worry about that. I could meet anybody, anywhere, anytime, and talk about anything. And now all of a sudden that has changed. And so I feel that we advocate. Advocacy actually comes in various forms. There is self-advocacy, and then there is group advocacy. Self-advocacy to me is like any time that I tell somebody, hey, I have this hearing thing going on, and I try to put it on the light shoulder and not be really pushy with people and demand. You know, so I just simply say, I have this hearing thing going on, happened to me very fast, and I really can understand in noise very well anymore. Is it possible to turn down the music a little bit in the restaurant? You know, because otherwise my meeting is not going to go so well, and we might have to relocate and go somewhere else. I give them the choice. You know, do you accommodate me or do you not accommodate me? My experience has been that they don't want to lose the customer. They know that like 4 people are coming, and they don't want to lose the customer. So they usually are pretty accommodating, and of course I return that favor by also recommending them to other people by saying, go there, you can ask, and they have done it for me, they'll probably do it for you. I also go early to the restaurant and scoop it out. You know, because I want to know where the fans are that are blowing. I want to know where the loudspeakers are. And I never try to sit by the kitchen, you know. And so I always say to him, can I have a different table, you know, not by the kitchen. I come from the kitchen, and I don't want to spend my time off in the kitchen. And so that is kind of an, you know, sort of an argument that usually also passes along. I try to find the seat in the corner, hopefully, where I don't have anybody on this side, I don't have anybody behind me, trying to limit that noise exposure, and never really go for the seats that are in the middle of the restaurant, where you get it from everywhere. You know, so I'm a big preparer. But I feel that every time that we sort of mention our need, you know, ever so you know, understandingly for other people, because they might not have a clue what I'm talking about. And so every time that I mention that, that's sort of like self-advocacy. And so we do this basically on a daily basis, and oftentimes we're not aware, and we don't call it maybe that way. You know, we just say, well, I mentioned my needs. Well, that's a form of self-advocacy. And then there is the group advocacy, where all of a sudden we have effectiveness and safety and power in numbers. And those are our groups like, for instance, the Hearing Loss Association of America, the HLAA. They are advocating and doing all sorts of things on behalf of people with hearing loss, you know, anywhere from a mild hearing loss all the way to deafness. We have here locally, we have the Commission for Deaf, Blind, and Hard of Hearing Minnesotans, the MCDHH, and I served with the MCDHH for 6 years as a governor-appointed commissioner. And so you're getting into all sorts of different facets of hearing loss. And for people with hearing loss, there is one thing that has to be understood. They have to support those people who try to help them and who advocate for them, and to respond to the messages. You know, maybe call your senator or your representatives, because there is a big thing going down in the legislature that could really affect us. And so we have to get tuned in, and we have to start doing for ourselves and support those who try to support us.
Okay.
Yeah.
Can we take a 2-minute break? I have,
Okay.
if we wreck something, we'll just pick it up.
We'll just pick it up. Okay.
So let's-
Yeah, or you can delete it if, you know.
Yeah, absolutely.
Yeah.
Let's
Okay.
have that conversation.
So it sounds like you are very open about your hearing loss. This is who
Yes.
you are, so you tell people right away. Can you give me an example of, you've met me for the first time, what would you say to me if we were in say we were at a gathering, informal gathering, but there's a lot of people. How would you ask me to be in a better place or to move or whatever? Just how would that conversation go?
Well, you have mentioned it already. First of all, I do not hide around the bushes about my hearing loss. I really have not felt that that was a good kind of a strategy for me. I have never been that kind of person. I'm always kind of maybe sometimes a little bit too candid about things, but anyway, I would probably, if we got into, for instance, into a conversation, first of all, I would try to get kind of as close without being invading your space to talking to you, because as the loudness or the noise goes up, I really have a terrible time. So when I go to parties, I usually am one of the first ones to arrive, and when it reaches a certain level, I am very sorry, but I have to leave. Or I also have to put earplugs in. Oftentimes I take the hearing aid out, I have to put earplugs in because I just can't take it, because I have a certain amount of what they call hyperacusis, and that came also, noise sensitivities came with that very sudden shock to the brain hearing loss. And so I deal with that also on a daily basis, where the world is too loud and yet you don't hear so well. It's kind of a paradox. But anyway, so I would basically maybe say, it's loud here for me. Would you mind moving a little closer to the door or something where we can have a little bit of a space and discuss this, so that I get something out of the conversation, because I really have trouble in hearing a noise. And that's basically what I do. And I have never really had people say, no, I don't want to do that. No, I have never had that. They always say, oh, sure, what happened? And we get actually into a conversation about what happened and about hearing loss. And so I kind of take that as a little tutorial to tell people. And maybe they go home and they're going to be saying, turn down your iPod to the kid, because I just met this lady, who was being put over the top with this loud noise exposure. So I always use everything to do a little bit of teaching. And so I have never had really anybody turn me down. Yeah. And that has been my experience, so I don't know.
Okay. Before we started, you mentioned about the concept of misinterpreting or mishearing what happens, or what people are saying. Can you explain what that's like?
Hold on one second.
Oh, okay.
And is he there? Okay, go ahead.
Okay.
Well, whenever I feel that I need to ask for clarification, and I do, because I don't want to misunderstand things and then, have what oftentimes happens to people when they try to bluff. That's what we kind of call it in the business. We sort of pretend that we don't understand them when we don't, because we are looking at the response of other people. And if they laugh, we laugh. And it might be inappropriate, it might be a joke that we really would not agree with. So I try to stay away from that, and that's why I'm actually being very honest about it. And whenever I feel that, however, that I have to ask for some clarification, or that I feel, that didn't sound right, it's not so much what I didn't understand or whatever, it is the aura that it kind of projects for me. It always takes me back to that time where this all happened, where life changed. And it reminds me again that life has changed. It reminds me that I am sort of a little bit on the periphery of the conversation and not right in the middle of everything the way I used to be. And then also, it kind of is a little bit of foreshadowing of what is there to come. Because as I'm aging in particular, it's not going to get any better. And the ear that has been damaged has not improved. And it has, it's also not really becoming much better. And so you kind of know that these communication issues and misunderstanding and not understanding, that is going to be par for the course as it goes down. And so it's just sort of this little bit of frustration of having to do this clarifying, but it's also a little bit of sadness.
Okay.
Yeah.
Is that?
Did you hear that?
I did, but it was what she was giving.
Oh, I
was
hope
so
not, because
good.
it was so great.
Yeah, I think we can live with it.
Okay,
Yes, I did
okay,
hear
good.
everything. And do we want to bring those guys back in now?
Are they ready?
I'm just going to guess. I mean, are we on topic, off topic, on this?
We're gonna switch to another one.
Or do you want to stay on this? This, was that, I'm not sure how all this is. Was that more related to the side topic that you brought up for Mary kind of part thing? Or were we back in the?
Yeah, we were back, I think, in the general
Yeah.
topic, yeah.
Okay. Now, before we start,
May be coming because they're feeling depressed, but this hearing loss may be an underlying factor.
Mm-hmm,
You know, as you know, so much of hearing loss goes undiagnosed for a very long time.
Right, exactly, that was going to be my
Yeah,
point.
so if we can talk a little bit about that.
Okay, sure.
Okay,
Cool.
are we ready? Okay, great. What are some things that you think that mental health practitioners should need to know about hearing loss so that they can either become aware of hearing loss in their own patients or some of the issues, isolation, depression, that kind of thing that they may be dealing with?
Well, the first thing that I would say is that it is very important to understand that hearing loss is, there is so much more to it than not hearing very well. You know, hearing loss is basically a total syndrome. It comes with all of the feelings and the emotions that we discussed earlier, and people feeling alone and having basically every single aspect of their lives affected by this communication disorder. I actually call it a communication disorder or an issue that is basically chronic. And so if I'm looking at my own life, it affected me socially, emotionally, financially, professionally, because yes, it contributed to my not working anymore as a hospital pharmacist and basically sort of having to bow out of that because there was no way that I could function anymore effectively and safely in the noise-confused inferno that hospital pharmacy had become for me. And over time, you have to realize that. So that might be a reason why people come and see a therapist. They also have, like I mentioned before, the relaxing social ties and the social connections. And maybe it is because they overuse their family and friends a little bit too much as a sounding board. But the feeling of depression and isolation is basically also one why people oftentimes might be using a therapy for. For me, it came in the way of help from a support group or two. But we do need to have some outside kind of sources. Hearing loss is basically also oftentimes in general medicine unrecognized and under-recognized. And that goes for children and for adults. In children, for instance, if you have a child that does even have a mild hearing loss, all of a sudden that plays out in the schoolroom as if they had like maybe ADD or ADHD because the symptoms are very much overlapping, especially to the untrained eye. And so that's for instance one example. And for adults, it's pretty much the same. If we do not recognize that, especially a person who might not even realize yet that they have a hearing loss, or an older person who lives by themselves, and they come to the doctor, and in the relatively quiet environment of a doctor's office, they might not kind of looking into the fact that that person might have a hearing loss, that it is just simply maybe coming with age or something might have happened. And so it goes undiagnosed and underdiagnosed. And so you might be seeing people who are coming out and they are on all sorts of very potent medications. And the underlying cause might be just hearing loss. And this is why they are not interested in life anymore. This is why they don't really want to learn anything new anymore, because they just feel kind of depressed and they just feel kind of dejected. And so then we are all of a sudden saying, well, hearing loss is tied to dementia. Yeah, hearing loss accelerates, I would probably say, if you don't use the brain and the interests anymore the way you used to. That can certainly set one up for a faster downslide and accelerate the process. Whether if you just simply treated people maybe with hearing aids, that would get them out more into society, that would already be a great change. And so recognizing those things and kind of putting the picture together, because this is such a big puzzle that has to come together for therapists, you know, that might already be really a good start to always keep it in the back of the mind. You know, what is going on here? At one point in time, I had written a blog, whatever happened to the tuning fork? Because nowadays, and I'll explain what that meant. Nowadays, you know, we are going, well, people have to go for hearing tests, and people might not be wanting to go for hearing tests. When I was growing up in Europe, we might have been very basic, but the children were always tested by the general practitioner for hearing with a tuning fork. You know, they had this thing, looks like sort of like a U, and then it has a little stick in it, and they would slap that thing, and then it would start humming, and they would take it to the ear and away from the ear. Do you hear this? Do you hear that? They put it on, test for bone conduction, put it on your forehead, on the back of your head. And so they got a pretty good, actually, basic evaluation whether a person might have a problem. What that problem was, but it would give us a point for starting an investigation. Rather than, you know, and so a doctor can get a screen. But nowadays, do we still do that? I don't know. I had asked one time to get, I said, why don't you tuning fork me? That was in the beginning when I was totally confused on what type of hearing loss I even had. I thought for the longest time it was my middle ear where the little bones got disrupted. And so, but the intern did not really know how to make that thing hum. So do we even teach that anymore? And so it goes from the very basic to the sublime. But when you deal with people with hearing loss, it's important to know, yeah, they might have hearing aids, but they still need accommodation. And so I would also feel that it is very important for people who meet up with people with hearing loss that they have at least some of the basic communication rules down, like facing a person, not speaking through walls and doors to people, having the room lit and not sitting in the half dark, turning off the noises. You know, even the little Zen fountain that twinkles in the back is phenomenally disturbing to people and takes away from that speech signal that is so important. And so to learn at least the basics about hearing loss, I think that would be great, especially if you're dealing with older people. And hearing loss is actually on the rise. And so they might also meet up with people where they do not suspect that they have a hearing loss. A lot younger people, much of it noise-induced. But anyway, to keep that in mind and to ask right up front, that should be a very elementary question. Before we even start, do you have a communication need? Do you hear me? Do you understand me? And that should be right up there with allergies, you know, not buried someplace down there under systems, you know. So those are some of the basics. Ask it up front. Know how to communicate. Keep it in mind that hearing loss might be a factor here. And then, you know, accommodate people and you know, be there for them and help them, you know, as best you can. Also, having a little assistive device in the office might help, like a little FM stereo, a little FM system, because sometimes hearing aids might not function too well for people. But if in the privacy of an office, they can use the little FM system and basically dial up how loud they want to have it, you know, the sound. That can really help a lot. And it also shows them, hey, you know, we're on friendly territory here. We're talking about everything, and, you know, and you're safe here.
Okay. One of the things you mentioned earlier was the importance of finding support groups. Can you talk a little bit about what support groups and that sort of shared experience, why that would be important for mental health practitioners to consider encouraging their patients to seek out support groups or help them, you know, actually find one or start one?
Yeah, starting one is one, because there are actually few support groups for people who are, especially for people who are hard of hearing. I don't know how it is with deaf people, but there are actually few. But one can always start one. Many support groups, just like many businesses have been started in a garage, many support groups can be started also in one's living room. You know, it can be just a few people, and that can be the support group. But support groups for me have been very important, because all of a sudden I came into this, maybe I stepped into the world of hearing loss, but I all of a sudden found peers who understood what I was talking about. I was not alone. I was not crazy, you know, for feeling the way I did. That guilt came all of a sudden off of me. And another thing was, I realized that it was so much also about others, because I was by no means the one that had the severest case ever of hearing loss and of balance issues. You know, actually, I can be pretty thankful that I am the way I am. There are so many people dealing with so much more. And so it was a total revelation for me. And then it is the learning. I have always been a big believer in education. And so that's basically what I always tell people when I go out there. Learn about it. Understand what is happening. You're going to become a better communicator with your health specialists, because you're going to be knowing how to ask questions, because you understand the background and the concept and all of that. And all of a sudden we had speakers, and one of the first speakers, of course, that I had when I came to the world of hearing loss at the HLAA was actually the executive director of the MCDHH, the Commission for Deaf, Blind, and Hard of Hearing Minnesotans, Mary Hartnett. And she came and she was the speaker that day. And boy, I tell you, for me, it was a total explosion. Because all of a sudden, this was not only about hearing so a little bit not so well or whatever. It was a new world. It was all of a sudden, we were talking about legislative issues. We were talking about so much more. And so that's when, it shifted for me. And so it has always been that I have learned a lot. I have learned a lot from others. I have learned a lot from peers. I try to share what I know. And so it becomes this whole exchange, and it is actually invigorating. And people walk away from there going, hey, I kind of think that I can do this. It gives you hope. You are not alone. And that's why I think that they are so important. They are not whining groups. Where people often say, oh, yeah, I go to the support group and, everybody's whining and talking about their issues. Well, yeah, we do talk about our issues, but you also are focused, and so that's how I see them. And I, like I say, forever grateful, forever, engaged.
When you think back to some of your experiences with these support groups, are there things that you heard or that people were talking about and describing that you think would be a benefit to mental health practitioners, whether therapists or people who are, maybe those resources to help people find a place where, a support group or whatever. But are there kind of common issues that you think that mental health practitioners need to be particularly aware of?
Well, first of all, I think that a mental health practitioner and also like audiology students and all those people would really benefit from one time coming to meetings and to see what actually is what actually is being said there, what is going on, and how the whole thing kind of flows. And so of course, with one meeting, sometimes one doesn't get a total impression of what is happening, and maybe the speaker that day is not totally engaged, or maybe one is running late and people don't get enough mic time or whatever. But I think that would already be good. The feelings or the things that we deal most with, in a way, it is a lot about emotions. And so one of our most popular speakers has always been a psychotherapist who is dealing particularly specialized in dealing with people with hearing loss, and who can really understand people and can also lead the discussion in a way where it doesn't spin out of control and where people are comfortable in sharing. And so, but emotions are always high. Technology is high. What is new in technology? How can I go and find help out there? And of course, then always the resources come up, because hearing loss is also a little bit of an expensive kind of a disorder. You might have heard about the prices, that are being asked for hearing aids, and so no wonder that sometimes people sort of shy back from getting technology involved too terribly much. And so oftentimes I have felt also, and maybe psychologists and therapists should also note that oftentimes people are being accused of being in denial and of having a vanity attack when they say, oh, I don't just like hearing aids, I don't think they look good on me or whatever, because they are thinking about the old aids that were much more visible of maybe their parents and grandparents. Oftentimes I have found in my experience that people have some pride, and that oftentimes all this denial and this obfuscating and fogging actually becomes some kind of a shield to hide behind. because they don't want to say that after having worked for a lifetime and all of that, that they really cannot afford all of this and they don't have help. And maybe they put kids through college and they spend their money elsewhere, and now all of a sudden it is their turn. And so I have suggested for Christmas, rather than giving another tie or a nightshirt, why doesn't the family take up a collection and contribute towards a hearing aid, and encourage this person. That might be much better than another indoor grill, And so anyway, so there are various ways of how one can work all of these things. But yeah, those are the topics, the where can I get help? And then feeling alone. And then, of course, that denial kind of thing that one has to work on, because oftentimes that's not all that it's made out to be. Yeah.
Okay.
Can I ask a question?
Is there anything that we haven't touched on that you think is important for mental health practitioners or anybody who's working or living with a person with hearing loss really needs to know?
For people who live with people with hearing loss, it's important to understand, and also for all of us and for the health practitioners also, because many people might be coming because they have these problems with the social and all of that. Hearing loss does not only affect the person who has it. Hearing loss affects everybody around them. And that goes from the workplace all the way through the families, the friends, and the people that they meet, interviews that they might be having with a prospective employer. It really kind of affects everyone because of that accommodation, because of that problem you're not understanding, and in background noise and so forth that we have already amply discussed. But to me, that is one of the things that people also who live with people with hearing loss have to understand, and to try to intervene. And I know it gets really tedious when people insist on denying it, and it becomes this tug-of-war at home. And so sometimes we always encourage at the hearing loss, like I have mentioned, support groups quite a bit, like at the Hearing Loss Association, we very much encourage actually family members and friends to come with people so that they too can learn and maybe understand what their loved one is going through, and that the loved one also can understand a little bit that it can be pretty tedious for the people around them. And that's what I started to understand when I said I became hard to live with. And I asked my husband, and he confirmed that, because he frankly didn't understand a word that I was talking about. He couldn't relate, And so it became for him frustrating, and he was as helpless as I maybe found. But that is important, that when hearing loss becomes an issue, family and friends become also involved, and to bring people around into that fold and to include them, because it affects not only the person with the hearing loss. And that's something maybe that I didn't mention before, but is very important.
Okay, great. Anything else?
I have some B-roll stuff, but
You did great.
Really good job.
very well.
Yeah.
Thank you. Thank you.
I'm gonna ask you
So
for a
much.
favor now.
All right.
Okay. So,
That was really good.
you should be interesting. I think that people should get more involved and help me out and help each other. And we should never kind of clash. That's not ever a good thing. And I really think that this is the way it should be done, because I've been through it. All right? Now,
Exactly.
there's a progression of things that have to happen here. So nice and slow. There's a slow progression of things, and I really think that that's important here. Okay? Well, there's some other things you did. You did some of these things, real slow, okay? And you were great with your hands. I'm listening to you and I'm watching your hands going, I wish I was getting that, because you were so expressive with your hands.
Who
So, yeah, who knew? I wanted to pan down, but then I would have missed what you were saying.
That would have been good.
What else? That was good. I would maybe do kind of a counting, like there's one thing, and then another thing we need to do is this, and then maybe even that, and then from there, we go on to whatever has to be done. Boy, I think that's,
So
that
is
was
is
great
doing
for
all
you.
these things, are you, is
He was
Then
saying you did a good
Face
job.
it at the camera, right there. Okay, and then just, when we move it, keep your arms right there and just turn it. Don't move it like this, just turn it, okay? Right in that spot. It's got a
Okay.
real tight shot.
Okay.
So just go ahead and Vanna White the thing for me, move it
Okay,
around and
okay.
show me how cool it is. Okay, we're rolling, so just kind of turn it a little bit. Perfect. Now turn it like this. And then goes kind of almost sideways with it. Push one hand, like your hands like that. Put your hands away from each other.
Oh, okay.
There you go. Turn sideways. Pull it. There you go. Keep going, keep going, keep going. And now slowly go back the other way.
Well, the one thing that Mary asked him to emphasize, he has one, I think one ear.
And hold it right there.